Okay, anybody else? I won't like, no, I wish I'd done my hair. Okay, friends, so looking at the heart. So the superior vena cava is here, the inferior vena cava, you might need to give it a little bend so you can see it. But these two vessels are going to feed into our first chamber. So that's the right atrium. Remember, it's patient's right, patient's left, okay? From here, the blood's going to go through our first little chamber. You can see me poke my finger through here. This is the tricuspid valve, because you're trying to remember. Thank you for the bit. Okay, so, and so from right atrium, tricuspid, down into the right ventricle. Remember, atria are at the top, ventricles at the bottom, okay? Also note that the muscle here is a bit thicker than what you see in the atria, because this is going to have to give a bigger squeeze. So big squeeze where it comes to that twisting motion, and the blood is going to go up through this little valve right here. This is the pulmonary valve, okay? And this little section here, I know that it's blue, but this is actually an artery, but it's blue because the blood is
with low is deoxygenated.
Deoxygenated.
I was trying
Good
to get the
job,
word right.
photographer.
Trying to get the word right.
So yeah, it's low in oxygen. The blood vessel is not actually blue. Let's just learn. Yeah.
Is this the one that you said it transported something?
Yeah. So it's taking the deoxygenated blood. So this little section here is the pulmonary trunk. So the pulmonary valve, pulmonary trunk, and then you can see this one where it's kind of splitting, and the other one's sort of tucked in the back here. But it will split to the left and right. So those are the pulmonary arteries. But on the model, they're blue, which can be a little confusing because arteries usually carry oxygenated blood. This is the one exception in the entire human body where an artery, because remember, arteries always leave the heart, but it's carrying deoxygenated blood. Because where's it going, guys? The lungs. Thank you. I was like, that was not a trick question. so it's not going to be oxygenated yet. It's going to go get oxygenated in the lungs. Okay, so that's a good trivia potential test question about is the pulmonary artery or the pulmonary trunk, is that carrying oxygenated or deoxygenated? It's deoxygenated. Okay, this might be easier to see on the back, but you have these little guys right here and then over here. These are the pulmonary veins. Note that now they have a red color on them because that is to signify that the blood is now oxygenated. So they are the only veins in the body that carry oxygenated blood. All the other ones that are like systemic circuit, the veins are always deoxygenated and the arteries are oxygenated. So the pulmonary circuit is split backwards. Because if it was a pulmonary vein leaving the heart, the pressure from the squeeze would blow it out. So it has to be an artery. It has to be bigger, stronger, thicker, more flexible. Okay, so thank you for coming to my TED Talk. So if you look real close, you can kind of see the holes where the pulmonary veins are returning. So they're going to go into our next chamber. This is the left atrium. From there, we're going to move through the bicuspid or mitral valve. And we move into our last chamber right here. This is the left ventricle. And note the difference in the thickness here. The muscle is a lot thicker here. So the right side of the heart just has to pump to the lungs, which are next door. That's not very far. The left ventricle has to pump down to your big toe and back again. So it's going to give a much bigger squeeze. The blood is going to be under much greater pressure as it basically shoots out of there. So you have to kind of like shove your finger in here. But the aortic valve, which would be the entrance to the aorta, is kind of tucked in the back corner of the left ventricle. But there's no cobwebs, I promise. You just kind of put your fingers in there. And then that would be continuous with, once again, the aorta. So this would be the ascending aorta. This would be the aortic arch. And then this would be the descending aorta. So, and then when it gets to the chest, once again, it's thoracic aorta and then abdominal aorta and all that fun stuff. Okay. Other stuff to point out while I got you here, the little white pieces here that are on the valve, those are the chordae tendineae. I think your book calls them tendinous something or other. I prefer chordae tendineae because that's what you're going to see next semester. And then the little red pieces here represent the papillary muscles. So if you remember when the heart squeezes, it's going to pull on those little papillary muscles, which will then pull on the chordae tendineae, which will then close the flaps. So when you're getting ready to squeeze here, you want to close the door behind you because you want the blood to go up the pulmonary trunk, not back into the right atrium or the left, depending on which side of the heart you're on. Okay, any questions, my friends? Mostly making sense? Okay, so here is your heart.